name is Kelley Blair. My pronouns are they and them. I am the CEO and the founder of Diversity Center of Oklahoma.
My name is Charles Whiters, and I'm everywhere. I just like being able to provide whatever resources is needed to the community.
What do you wish were different specifically about access to mental health care and mental health resources in Oklahoma?
That's a big one.
Okay. Well, what I wish that would be different for the mental health here in Oklahoma is that we open up facilities that's going to provide the help that's needed, right? Not county jail, like not prisons. That's what they do here in Oklahoma. We shut down all our facilities and we place the people who's dealing with something inside of these places, which causes them to deal with something else on top of something else, which causes the situation to be worse. So I wish that we would open back up these facilities to where we can treat people dealing with these issues as human beings and understand that they have something that they're going through, that they need a little bit more counseling. They need to be taught, they need to be handled with care, so that they can break through that shell.
Like
and come out.
wraparound services.
Right. So that's what we need more so here in Oklahoma. We need more people, more programs or organizations to where we can, whenever you get a 911 call that someone is out here having a mental breakdown, instead of the police coming, it would be someone in the mental health field, someone who's trained, certified to deal with that, than someone just coming and sticking a gun in their face. So I wish that Oklahoma would take an approach on treating mental health more serious than trying to make money off of it.
Well, and make it where it's more accessible. I've worked in ER settings where these folks come in that are suicidal or homeless folks that end up being brought in by law enforcement. And they get in for a short period of time for crisis intervention. And they get their medication, but then they're back in again because they aren't able to follow up with services. And they don't have access to be able to follow up with those services because they are homeless. And so how are they going to follow up with those services?
Right.
They don't have transportation. They don't have any
identification.
They don't have IDs. They don't have a home. It makes it impossible. So it's just an endless loop for them. And so, like you were saying, we need to have some kind of way so that it's consistent for them, and we can have those wraparound services so that they can eventually get on their feet, and that is what they're desiring. There are some folks that's not their desire, and they should have that right too. But if they are wanting to have that ability, then we need to be able to help them to do that.
Right.
And there are programs out there in other states that do provide that kind of service for them.
Other states is actually taking mental health serious. And here in Oklahoma, I noticed that like about a year ago, we had a lot of organizations and programs who was voicing that they was wanting to change, so they wanting to step up and help, do more here in Oklahoma for that field. But I guess due to time and money, nothing has been done about it. So
and
it's
we've
just
had
still
some programs that have gotten into place, but funding just is
right.
So that it doesn't stay, or other programs get put into place. It makes it really hard.
Yeah, it makes it difficult.
What are some resources parents can look into to help them better understand their child and maybe help prevent further mental health problems?
Parents don't get a guide when kids are born. And I don't think that a lot of parents know the stages of development for their children. They don't realize what children's actual capacities are. And so their expectations for children are so unreasonable. And I know mine were, because I was a young parent and I didn't know what the expectations for a child that is 2 and 3 and 4 years old. Children don't understand long-term consequences. They don't. You see parents spanking their children and slapping their hands like they understand things, like, they do when they're 9 and 10 years old or when they're 14. I tell parents all the time when they come into therapy and they're like, well, my child did this, or they're doing this on purpose to just make me mad. And I'm like, your child does not understand long-term consequences. I think if they understood more about their child's development, maybe they could put things in perspective better and not cause as much harm to their child. I don't think they intend to, but that does cause a lot of behavioral health issues for children, and a lot of distress on children without even meaning to. That doesn't say they don't love their children. I think parents love their children. For the most part, they love their children. They have well-meaning.
Well, most humans is not going to really get it until they're about 25 years old. So for a parent to be able to understand behavioral issues or differences or what a child is going through, like you should, most parents is at an age to where they can sit and basically read their child, and if you're paying attention. But the thing is that a lot of parents is taking on 2 jobs or a job and going to school, so they may spend anywhere between 3 to 4 hours a day with their child, so they can't identify when their children is having these breakdowns or these episodes. They probably have to hear it from the grandparents or whoever the babysitter is what the child did, but the parent is the one who take the action to get that child help. But the parent will have to be around to see this before believing to get this child this help. So with that being said, that's just another situation to where it's normally that you won't find out the information until it's too late.
That too. I think that's a really good point, is that people are tired too. So there's so many different aspects to it when it comes to parenting kids.